There's a concept in modern medicine called the Cascade of Care, and it's something most seniors don't hear about until it's too late. Every year, millions of you line up for routine checkups, assuming more testing equals better health. But medical consensus is shifting. Leading organizations like the American Board of Internal Medicine now warn that up to 30% of medical care is unnecessary. In many cases, these tests trigger false alarms, leading to biopsies, anxiety, and treatments for conditions that would never have harmed you. Today, we are uncovering 5 health checkups that, according to the latest guidelines, you should approach with caution after age 70. Number 5. The Bone Density Scan, DEXA, for mild osteopenia. It sounds responsible to check your bones constantly, but here is the nuance. For women over 65, screening is recommended, but not every year. If your first scan shows mild bone loss, osteopenia, which is normal for aging, and you have no history of fractures, doctors often rush to prescribe bisphosphonates. While these drugs are crucial for severe osteoporosis, they carry risks like heartburn and rare jaw issues for those who may not need them yet. The fact: the American Academy of Family Physicians suggests that if your baseline scan is normal or mild, you likely don't need another one for several years. Focus on vitamin D and resistance training first. Number 4. The Brain MRI for mild memory lapses. When we forget a name, we fear Alzheimer's, but ordering an MRI for normal age-related forgetfulness often causes diagnosis panic. The fact: in seniors, brain scans often reveal incidentalomas, harmless white matter changes or tiny cysts that have been there for years. Seeing them doesn't fix your memory, but it does trigger expensive, invasive follow-ups. Radiology guidelines state that unless you have specific neurological symptoms like seizures or rapid decline, a clinical cognitive exam is the safer, more effective first step. Number 3. The cardiac stress test, if you have no symptoms. For years, this was the gold standard checkup, but if you are over 70 and can walk up a flight of stairs without chest pain or shortness of breath, a routine stress test often causes more harm than good. The fact: these tests have a high rate of false positives in older adults. This leads to angiograms and stents that, according to the federally funded ischemia trial, do not prevent heart attacks or extend life for patients with stable heart disease. If you feel fine, a routine EKG is usually sufficient. Number 2. Routine colonoscopies after age 75. This is controversial but vital. The U.S. Preventive Services Task Force does not recommend routine screening for everyone aged 76 to 85. The fact: the risk of complications, like perforation or reaction to anesthesia, increases with age. If you've had negative screenings your whole life, the chance of a colonoscopy saving you from cancer at 80 is statistically very low, while the risk of the procedure itself is real. Talk to your doctor about non-invasive stool-based tests, FIT tests, instead. Number 1. The full-body CT scan for screening. Often marketed directly to consumers as a cancer check, this is the one most legitimate doctors advise against. The fact: there is no medical evidence that scanning a healthy person without symptoms extends life. However, we do know that CT scans expose you to high levels of ionizing radiation, equivalent to hundreds of chest X-rays. A study in the New England Journal of Medicine estimates that cumulative radiation from imaging may contribute to a small but real percentage of future cancers. Searching for a needle in a haystack often results in invasive biopsies for benign nodules, damaging your lung or kidney in the process. Conclusion: modern medicine saves lives, but more medicine isn't always better medicine. Always ask your doctor 2 questions. How will the result of this test change my treatment? And what are the risks of a false positive? Preventative health is powerful, but make sure you're preventing disease, not inviting unnecessary treatment.